Welcome to the Sowing Seeds Specialty Series, Psychiatry. My name is Amara Onia, and I'm co-chair of Alumni Affairs this year, as well as co-chair of the FLP program. And I'm super delighted to be here today as your moderator for the Sowing Seeds Specialty Series, Psychiatry. This series is a part of our Sowing Seeds program created by our past national president, Osise Obo, and continued by our current president, Nita, in collaboration with the Alumni Affairs National Committee. Throughout this year-long program, we'll be providing resources to students on how to succeed as a pre-med and as a medical student, and we'll also touch upon everything from financial literacy to preparing for board exams and more. So make sure you are a member, a national member of SNMA by visiting snma.org and signing up to stay in the know. Today, we have a wonderful panel of doctors who are here to talk to you about psychiatry and their journey within that, and also to answer questions for you. First, we have Dr. John Saunders. He's a vice chair of diversity, equity, inclusion, and at Baylor Medical College of Medicine. Welcome, Dr. Saunders.
Hello, I'm happy to be here.
Thank you. Next, we have Dr. Brian Dixon. He's CEO of Mindful Psychiatry and Simply Psych at Progressive Psychiatry. Happy to have you, Dr. Brian Dixon.
Hey, y'all. Thanks for having me.
Yes. Next, we have Dr. Bridget Bailey. She's a child adolescent psychiatry resident training director at UT Health San Antonio. Welcome, Dr. Bridget Bailey.
Hey, everyone. I appreciate being on this panel tonight, and I'm looking forward to having a good time.
We're looking forward to it, too. Next, we have Dr. Adora Ogoke. She's psychiatry resident PGY3 at Essex Tech University Health Sciences Center. Welcome, Dr. Ogoke.
Good afternoon. Good evening, everyone. Thank you for having me.
Yes, we are glad to have you. And last but not least, we have Dr. Francois Williams. He's psychiatry resident PGY3 at Baylor College of Medicine. Welcome, Dr. Williams. It was a little bit hard to hear you, Dr. Williams. I think the connection broke off a little bit, so perhaps headphones work from much, but once you get that running, we'll also welcome you again. But in the meantime, let's do our personal stories from our doctors. We're so glad to have you here. And let's start off with Dr. John Saunders. Definitely tell us where you went for medical school, where you're at now, the mentors you had along the way. Why did you choose your particular specialty in psychiatry? And then end with something that's your favorite part of psychiatry. So we'll start off with you and get the ball rolling.
Okay. Well, I trained at the University of Pittsburgh. I consider myself a Texas native and recognize that if I didn't leave the state at some point, so if I stayed there for my residency training, that I'd never leave. So I wanted to see a different part of the country, went to Pittsburgh for my medical education as well as my residency. I did a general psychiatry residency. They had a community psychiatry fellowship, so I did that as well, but it was during my fourth year of residency training. I have been extraordinarily fortunate to have lots of mentors. I've been encouraged to have mentors in different fields. I picked psychiatry for lots of different reasons. One of the things that stood out to me was the connections that you're able to make with your patients, that the nature of who you're seeing, those type of interactions. I initially thought that I would be a neurologist. I did neurology and found that psychiatry was a much better fit. I found that I was taking psychiatric questions with me to other clerkships during my training and found that it had everything that I liked about neurology, things that I had liked about toxicology, internal medicine, and it was all available for me within psychiatry. And so that is why I picked psychiatry, as well as experiences that I had during my training that kind of helped me understand how this fit within kind of my larger view of the world. I think psychiatry is unique in that it offers you perspectives on lots of different larger societal issues like criminal justice, early childhood education. All of those things are things that you need to understand when you're dealing with patients who are struggling in a mental health context. And so the thing that I love the most about this field is the variety, the ways that you can practice psychiatry, the patients that you'll see, the interventions that are available. And so it is this idea that you're always learning and that there are always these wonderful opportunities to improve and to help your patients improve.
That was lovely. Thank you so much. Yes, I think the variety in psychiatry is really enticing, especially for those of us like myself who can't make a decision on what you want to focus on. So definitely very good to hear. Next, we have Dr. Brian Dixon. We'd love to hear your story.
Yeah, so thanks for having me on. So I'm originally from Lufkin, Texas, so East Texas, born and raised. I went to Baylor for undergrad, Texas A&M for medical school, and I was part of SNMA during my medical school time. So I think it was Region 3 at the time. So and then I did the triple board program at the University of Kentucky. So I did a combination of pediatrics, adult psychiatry, and child psychiatry. And I chose that. So I didn't think I was an overachiever during medical school, but I chose that because of I loved child psychiatry as a rotation. And then I realized that I also loved pediatrics. And so at the time, I discovered there was this thing called triple board program. And so interviewed and decided to go into that. I think it was the best decision, almost one of the best decisions of my entire life, because I was able to really get a firm foundation of the medical model and understand pathophysiology from that perspective. And I think that makes me a better child psychiatrist so that I can be very creative in the things that I do with the families that I work with. I'm a terrible employee. I learned after job hopping a few times that I can't work for anybody else. And so I started a private practice in 2014, and I've been doing that ever since. And that's one of the reasons why I love psychiatry. So we're kind of we're a creative space as a specialty because not everything is set in stone. And as most of my other panelists can attest, we change our book every 5 to 10 years and create new diagnoses and change other ones. And so I love that creative space. I would say one of the things that I also love is just the autonomy side of things. So I love being able to sit with the family. I do a ton of therapy, a ton of behavioral therapy because I love kids who throw fits and working in that space. And so being able to craft what I want and work with families of all backgrounds to help them function better and feel better. That's my jam. And so I'm super stoked to be here. Ooh, Dr. Amara, you're on mute. I think you owe the group $100.
Yes, I was on mute. We are glad to have you. Did you have any mentors along the way?
So strangely enough, I didn't have hardly any psychiatry mentors. I had a lot of really positive Black medical role models that helped push me through medical school and residency. And even now, I still, this is why this is so amazing to see other Black psychiatry faces. And so I'm looking forward to staying in contact with everyone.
Perfect. Sounds great. And I think everybody wants to stay in contact with everyone too. So it's always nice to build up that network. Next, we have Dr. Bridget Bailey. We'd love to hear your story.
Hi. Again, I'm Dr. Bridget Bailey, and currently I am in San Antonio, Texas, and as the program training director for child and adolescent psychiatry. So I'm originally from Albuquerque, New Mexico. Did my undergrad there, medical school there, and I did not apply to our psychiatry program there, even though they had one of the best child psychiatry programs at that time, because born and raised, lived there all my life, so I thought I needed a chance to go other places. So I chose San Antonio, Texas to do my general psychiatry training and also at my child training here. So why I chose psychiatry, I would actually say I always knew I was going to be a child psychiatrist. There were no doctors in my family. I didn't have a role model. I didn't have a mentor, but this is a route that as a kid, I just always knew I was going to be. So undergrad was psychology with a minor in chemistry, because that was the road to, my ticket to get into med school. And sadly, I did not have mentors in my medical school either. I was the only Black one in my class. My friend was the only Black one in the class above me, and for I think most of our time in medical school, we were it at that time for the whole 4 classes. So kind of struggled on my way. I wish I would have known about SNMA back in the day, even if there was nothing, there wasn't a chapter in my school, at least I would have had national contact. So things that I chose psychiatry, besides it choosing me, is psychiatry, I think, is the most creative discipline of medicine. It is not cookbook medicine. Yes, we have some standards, we have, guidelines, but it allows you, as Dr. Dixon was saying, a space to be creative. I'm very curious. I like hearing about people's different stories of how they got to be where they are. So I can come in and see 10 depressed patients in the same day, but their journey is going to be totally different. And that is what I like. Psychiatry allows you the creativity to craft your treatment plan to the family that you are speaking to. Now, I'm one of the child psychiatrists that I actually love all the ages. So my first year, 5 years out of residency, I saw kids, I saw adults, and I actually saw geriatrics because I love talking to old folks because their journeys are just amazing. But as child psychiatry got busier through my career, you sort of let a lot of other things go because there's not a lot of us child psychiatrists practicing here in the United States. So I've gained mentors along the way late in my career. And so, but once I got into academics after my first 5 years of being out, that was my goal, is to be a mentor to African-American medical students and other students who are on the fringes, just to help ease their journey through medical school and residency if I can. So that's how I came to be. I love educating people, so that's why I'm training director. If I would have chosen another discipline to be my profession, I probably still would have been an educator in that discipline. And so that's my story of how I ended up being in psychiatry.
We love to hear it. Thank you so much. Beautiful story. And it's also a testament to yourself to be able to persevere without having someone telling you or giving you direction of how to go about doing it. And it's just so lovely to hear that you are then filling that void that you had yourself for others as well. So it's what we like to do here in the SNMA. So grateful to have you. Next, we have Dr. Adora Agoke. I would love to hear what you have to say.
Hi, everyone. So I would say that psychiatry was one of those specialties that kind of found me in a sense. I'm first generation Nigerian American, and I come from a very strong egotistic culture where pursuing medicine is not atypical whatsoever. However, I wanted to pursue a specialty in medicine that really resonated with me. And I have siblings who, have their fair share of mental health diagnoses. One of my brothers he has severe autism, and my other brother has intellectual disability disorder. And, just being a sibling to, family members with mental illness definitely has an impact on how you view your life, how you view your own mental health. My brother didn't have psychiatrists throughout their life, and in my culture, it's more of a prayed away type of thing, pray on it. And I wanted to be, an advocate for mental health. I wanted to be that psychiatrist that my brothers really needed during their childhood and adolescence. Which is really one of the reasons why I want to go into child and adolescent psychiatry. I was, born in Arizona, raised in New Jersey, but I really did love my family and my support system in Arizona. So I actually ended up going back for undergrad at the University of Arizona in Tucson. And then I was like, I want to stay on the Southwest. So I ended up applying to some local medical schools in the area. And somewhere down the line, I really found osteopathic medicine to resonate with me. The holistic approach is always really beneficial and helppful, and just viewing patients in that lens. So early on, I had a mentor who was a DO. He was an anesthesiologist. So I actually didn't really gain any mentors until I would say like end of my third year of medical school. I attended medical school in Las Cruces at Burrell College of Osteopathic Medicine. It was brand new medical school, so I was part of the inaugural class. And that's kind of during my clinical years, I was able to find a child and adolescent psychiatrist that kind of took me under his wing. So yeah, I love psychiatry because not just because it focuses on, you know, wellness and mental health, but it's because I think it makes an impact on the livelihoods of our patients in a way other specialties don't. And there's something so warming about being able to see a patient at the clinic. They come in, you know, with their life stressors. They pretty much release all their stress onto you, and then they're like, oh my gosh, I feel better talking to you. Like this, you've provided some sort of maybe not a solution, but it's like there's something in the plan we can work on, you know. So yeah.
Thank you so much. It's always nice to hear the personal stories of what brought you to your field. So lovely to hear that. And hopefully you can continue sharing that story to others, because I can see that really touching others as well. And last but not least, we have Dr. Francois Williams. We'd love to hear your story.
Hi, good evening. Can you guys hear me okay?
Yes, we can.
All right, awesome. So yes, my name is Francois Williams. I'm originally from Dallas, Texas. I went to Xavier University of Louisiana in New Orleans. I was there during the post-Katrina years, was a biology major, was very interested in the social determinants of health. Particularly after Hurricane Katrina, I became sort of interested in how natural disasters impact not only people's day-to-day living, but also how natural disasters sort of, in some instances, gave rise to mental illness. During my time at Xavier, I was involved in a lot of service learning activities, as that sort of was the model at Xavier University of Louisiana. I found myself working in charter schools, and really by my sophomore, junior year was interested in education, sociology, psychology. And I was actually flirting with the idea of leaving the biology and chemistry department altogether. I had the opportunity prior to my junior year to do a summer internship at Yale School of Medicine, and happened to run into Dr. James Comer, a child psychiatrist who was doing a lot of good work in the community, was working within charter schools and public schools, working to make the lives of children better through sort of getting parents, teachers, and students all on the same accord. I felt that that work was very meaningful, and I felt that that work was in line with the service learning opportunities that I had in New Orleans. And it was sort of at that point that I knew that psychiatry, particularly child psychiatry, was something that spoke to me. I had a ton of mentors in the field as I was going through medical school and through residency. Dr. Stephen Starks, Dr. Sarah Vinson, Dr. Kevin Simon, Dr. James McCoy, Dr. Quentin Smith, Dr. Patrice Malone, and Dr. Erica Goodwin really helped in my maturation along this journey. And it was really through the Dr. June Jackson Christmas Summer Fellowship that was offered at Columbia University, which was a summer fellowship for first year or rising second year medical students, that I was really exposed to the wide breadth that psychiatry had to offer. I was exposed to psychiatric rotations in inpatient settings, outpatient settings, consult service, the ACT team. And it was really through this experience, again, the June Jackson Christmas Summer Fellowship, that I was able to sort of make a more informed decision about psychiatry as a specialty. And my favorite thing about psychiatry is my ability to just really connect with people in real time in a very authentic way. I'm very fond of listening and hearing people's stories, and I love what I do.
And it's so great to have you on here. So it seems like that program in Columbia was very instrumental in helping you get to where you are. And it's just like those moments where you just have serendipitous moments that lead to, you can look back and think, oh, wow, that was a pivotal moment that allowed me to be where I am today. And then hopefully Sowing Seeds can be like that to our audience or anybody like that listening as well. But love to hear the stories. I think the first question we'd like to start off with today would be mainly geared towards the residents. So how was your transition from being a medical student to your residency in psychiatry? What were some of the things that you learned about yourself over the past year or so as you transitioned into residency?
I guess I can go first. And I do want to mention I went to Morehouse School of Medicine in Atlanta, Georgia. I left that out. That's very important. One of the things, or what was the question again? I'm sorry.
Yeah. So how was your transition from being a medical student to being a psychiatry resident? And what are some things you learned in that transition period?
Definitely. One, I felt like my medical school did an awesome job of preparing me for residency. So first and foremost, I would trust your medical school. I would trust the process. I was fortunate enough to be a part of the American Psychiatric Association, who I felt provided me with various summer internships that prepared me well for this journey. And lastly, I think it's important to be a self-directed learner. I think that's one of the biggest things that I learned transitioning from medical school to residency. And in medical school, there was a lot of structure, particularly at Morehouse School of Medicine. And in residency, it really is up to you to sort of read and look at, video resources to sort of hone in on some of those skills. And residency, we do have didactics, but it's only once a week at the most. And there's just a lot of content to sort of cover on your own. So reading about your patients after you see them at the end of the day, going to conferences and listening to talks, attending grand rounds, all of these things really add to the sort of self-directed learning process.
So I'm actually the class of the COVID pandemic. So I started residency in the thick of it, and it was rocky. I mean, I started my first rotation in the inpatient setting, and they had completely changed the dynamic of like the units. Like they had flipped, the acute units. It was like I was relearning something that had already been set in like stone almost, like having to rewire, change how things were looking and running in the hospital. So I felt like I had a lot of anxiety going in just because of like how things were with the COVID-19 pandemic. But I really did rely on my seniors I relied on my attendings. Communication is so important, especially early on. Asking questions, like even if you consider yourself a shy, nervous person, like you have to ask questions. Kind of be willing to put yourself out there, and be ready to take on difficult patients day one. Like don't hesitate to do that. Don't hesitate to kind of just allow yourself to go through the pains, the bumps in the road. So, and remember to take care of yourself. It's really hard to prioritize yourself when you're like, I'm here for the patient. I want to do everything for them, but you have to take care of yourself first, in order to take care of others.
Right.
So
Yes.
that's my take on it.
And then perhaps to dig a little bit deeper, how was the transition, or how did you guys navigate the interdependence versus supervision? How did you balance that and try to figure out how to do that as a resident?
It was something that came easy, I guess. As somebody mentioned earlier with psychiatry, there's really no one size fits all for patients. And there was some trial and error, but your attendings are there to support you. Your upper level residents are there to support you.
Sure.
The nursing staff is there to support you. So I think there's a lot of room to sort of grow and learn and experiment as we sort of grow and get things right with the patients. I also felt that my sub-I as a fourth year medical student really prepared me for the journey to residency as well. So for all of you now fourth year medical students out there, I would encourage you to do a sub-I in psychiatry, maybe even in neurology as well, as a means of sort of taking ownership of your patients and taking more responsibilities, as it'll serve you well as a psychiatry resident. And even if you're not a psychiatry resident, in the end, you're going to see psychiatry, you're going to see patients with psychiatric illnesses, irrespective of the specialty that you go into. So I think it would be wise to sort of explore psychiatry, whether you're 100% set on psychiatry or whether it's something that you're very curious about and sort of exploring at the moment.
That sounds good. Okay, I do believe that having some sort of at least knowledge base or a foundation so that you can at least direct patients to the right area, even if you don't go into psychiatry, I think is important. And it's nice here that it wasn't so difficult, the balance between depending on others and knowing what to do yourself. So I think that's always a scary part of the transition. So good to hear that that was not too bad. And then for our other panelists, it would be great to hear your thoughts on what you're looking for in a strong applicant. What do we need to do now so that we can position ourselves very well for the match?
So I'll start off with that question. So each program is going to be a little bit different, right? So you are going to need to do some research and look at programs' websites, maybe even reach out to the chief resident of the programs you're interested in and talk about the program. Because for my program, my main things I look for is people who can be a team player, right? Because if you have one person out of the whole group who is not a team player, it impacts everyone from residents, med students to faculty. So especially with the COVID pandemic, people are out sick or family members are out sick. And sometimes we need to pull together as a team to make things work, right? That might mean extra call or volunteering for an extra call, moving from that one clinic to another. because bottom line is we want to take care of patients while we're taking care of ourselves. So we want our people who are sick or the family members are sick or they just need a day off. We want to be able to cover for each other without squabbling about it, right? Or complaining or whining about it. I'm also looking for someone who doesn't mind hard work. In psychiatry, at least my fellowship, we are not working 80 hours a week, right? That's your maximal limit is 80 hours a week. And I came up through the days where you worked over in-house. This is not at-home call, 100 hours in-house every 7 days.
Wow.
So you don't want people to have to do that. So, but you still need to work hard when you are there. We picked the profession of being doctors, right? Our patients didn't pick being patients. They just are patients because something happened. So it's on us to put in the hard work to do what we need to do in medical school and residency so that we do have that piece of paper behind our name. And then we can make decisions such as Dr. Dixon saying, hey, I'm working by myself because I can't work for others. I'm in academics because I like to teach and I wanted to be available as a mentor, providing something that I didn't have to make it easier for someone else's journey. But we all need to work hard. So, I look at scores and, there's a lot of things going to pass, fail. I just need to know if you have any testing issues. So when you're in training, that we can provide some extra opportunities for you so that you can pass your board certifications, your annual in-service exams. You don't have to, I don't even look, if you don't have a letter of recommendation from, say, a child psychiatrist, then I'm okay. I prefer you to have a great letter from someone in another discipline that knows your work than a tiny paragraph from a child psychiatrist who really didn't know you, right? Because you want someone to speak on your behalf. Because I look at applications, but I'm really looking at your personal statement. And then I'm looking at other things in there. So it's not necessarily just academics. You made it this far, so I know you can make it with proper training to the end of the road. But I'm looking at what's going to set you apart and how are you going to fit the team that I'm putting together. And that means hard work, teamwork, and just being proactive and being a self-directed learner. Dr. Williams is correct. There is a lot of information you have to learn and not enough didactics for you to learn it in. So that means reading on your own more than just the day that you spend with patients.
Yeah, and to piggyback on Dr. Bailey, it is a working job interview, and I always encourage students, whether you're pre-med or whether you're a medical student, when you're thinking about residency, that is an active job site. There are people who are coming and going, and just like Dr. Bailey said, you are literally taking care of patients. And so, if you get into a residency and you happen to leave for whatever reason, whether it's not a good fit or that sort of thing, it is super, super, super disruptive for the other residents. And so one of the things that a lot of residents do when they're looking at candidates that are coming to their program is they want to make sure that, yeah, you can work as a team. And so if that's an area of concern for you, by all means, reach out to other folks at the level that you're at, be that pre-med or be that in medical school, talk to your student affairs folks, and really kind of get the nitty gritties of how to work as a team and be a team player, because that is make or break for residency.
I'll echo both of those things that Dr. Dixon and Dr. Bailey said about being a team player, having perseverance. The other thing that I will highlight is it's bidirectional. So not only is it about you displaying kind of why it is that you want to go to that particular residency program, but it's important for you to feel like that residency program is a good fit for you. And so doing the research beforehand, reaching out to people, absolutely do that. Make sure that this is a place that you want to be, because the work is hard. And if you're not in a place where you feel comfortable and you feel supported, then it's much harder. And so those are things. The other thing that I would say, and I'm not a program director, I interview occasionally, is make sure that you understand why you want to go into this field, because that's part of your story. So being able to communicate why whatever field you go into is what you're interested in and passionate about. So on those days when you're dragging and you don't want to be there, there's that aspect of it. This is why I chose this particular path. And if you can communicate that to the people that you're interviewing with, it will come through, and it will be something that speaks highly to why you're committed to this field.
Right. And I'd like to add that, I mentor all folks not, most of them have not gone into psychiatry, but that's okay. But, on the last probably maybe 4 years, maybe 5, it's iffy on the 5, that I've seen a lot of Black medical students choose the love of medicine, which is psychiatry. So the numbers are going up, and I am just amazed and happy, because people of color also need to see people who look like them, who are treating them, who may have a different level of understanding or a level of automatic trust that they will understand their journey and not force medications or therapy or things that they may not be able to fit into their life, but just to see someone who might have a shared story or a shared history. Other things I think that you need to be prepared for to set yourself up to be a great candidate is you should always be looking for extra opportunities that will fit you. But don't pick opportunities that it looks good on your CV, but you can't stand it, right? You want to pick extra opportunities that you enjoy and that shows your creativity or your sense of that you have a balance. So if you are you do volunteer work at certain places, and that's how you balance medicine versus your personal life, those are still excellent activities to do. So just do your homework, be prepared. I'm just going to say it like it is. If you're a person of color, especially Black folks, we're not going to always have an easy time wherever we land up. So most of us don't have to deal with discrimination or race issues, but some of us will, and you need to have an understanding of how to navigate those waters before you get there. Have those conversations before you reach residency, because lots of things happen. No fault then who you are and who you look like when you walk in the room. But if you are unprepared for that, if it happens to you, then your chances of coming out of that go down, meaning being healthy and not being angry or depressed or super anxious, or that you decide to leave the profession or the profession makes you leave. So don't let all those unspoken things that that people don't want to talk about them before you get to residency.
And I want to echo that by saying that the APA's Black Caucus is there. The Black Psychiatrists of America are there. SNMA is there. There are wonderful mentors out there that are willing and able to help and sort of guide you along your journey. So keep that in mind.
Right. And also the ACAP, right, which is the analogous for the APA for child psychiatrists. They have Black caucuses. But, even if you are not joining the Black caucus and you're another people of color, there are caucuses for everybody in national organizations. And so please join. My best advice is wherever you go, even if there is no one who looks like you, find a mentor that you meet with at least once a month just to kind of check in. Some programs assign you a faculty mentor when you're an intern. Sometimes that's not the greatest match, but if you find an attending there or someone in another department that looks like you. Make those connections, even if you are uncomfortable making those connections or a little shy about reaching out, because all they can do is say no, and then you move on and find another mentor, because it's that match. You want someone who understands the space that you are in case bad things happen.
Right, right. I hope you guys were taking notes. Lots of gems were just dropped right there. So definitely, I was because this is important stuff. And I think one thing that's also be helpful for our audience as well, and the question that comes up a lot is for our IMG students, like how do you suggest they navigate the residency or the ERAS applications, and just to be able to get into a U.S. medical program? And then additionally, it'd be good to hear from you, Dr. Ogoke, like how did you navigate applying with after going through a DO program? Is there a difference, or is there not a difference? Just would like to put that out there for our audience.
Yeah, for sure. It's wild because the year I applied was the year of the merger between the osteopathic, originally osteopathic programs, and those of like the allopathic programs. So it was like the first year where both MD med students and DO med students were applying to like all these programs and really being told that they were going to be given a fair shot in regards to reviewing of their applications and interviews. So there was, a bit of anxiety and hesitance around that. I come from a new DO school, so I pretty much applied pretty wide. I threw my net pretty wide out there. I really am passionate about community psychiatry in regards to just giving back to the community. So I applied to a lot of programs that really emphasized that. That had those same morals and ethics. But it's really about building your application in a way it's genuine, it's to yourself. Having letter writers that know you well, that can speak on your behalf. And I also did some visiting rotations as well to kind of just, build connections, have people help me with my application, just continue to ask questions and be curious along this journey is just what really helps me in the process.
Sounds good. Yeah, definitely. The more questions you ask, the more people get to seek out to answer those questions. Are there any advice for IMGs in particular?
So my advice there's being a program director and our interview season is upon us now, because our fellowships are, we complete our match, dates that everyone knows where they're going is the beginning of January. So we're off from the usual intern rotation, but it depends on the schools that you apply to. A lot of things are masked. So like when I start getting applications, we automatically mask certain things that don't show up, in the initial screening. So unless your name is pretty common for a woman, I don't even know the sex. I don't know the race. I don't know a lot of things that could potentially bias our selection, right, on who's getting an interview. And we purposely do that so that we look at just the application. All my faculty do not have access to all that information. And we send the pictures out usually like a day or two before the interviews when you're on the interview schedule. So I don't have pictures to the applications. There's a lot of things that we screen out, and many schools have taken that route so that you can have some holistic selection process to eliminate unconscious or conscious bias of applicants. So certain things you will know for IMG is visa status, because one is some schools only take certain type of visas or residency programs. So do your homework before applying and see if your program you're interested in is able to take the visa that you are under. You know, because some have a broad range of visas they accept, others do not. So that was part of your research that you're going to be doing on the schools that you have. But many programs are doing that. It's recommendations from ACGME, which is graduate medical education, and the LCME, which is the medical school accrediting bodies that want to try to make a level playing field. The playing field is not level, but they're making attempts, right? And those attempts are going to take a long time to be there. So you want to take control of your destiny. Do what you can to always steer your own ship, right? In wherever you're going. So that means always being prepared. Expect to perform at a better, higher level than your peers. It's not fair, but that's the way the world is. You want, when bad things happen, it isn't because you slacked off and you were unprepared.
Great words of wisdom right there. Yeah, definitely felt that one.
And I want to add too, it's a good idea to maybe look at where other IMGs are going across the country. Okay. I'm at Baylor, and a lot of my colleagues are IMG, and they're very solid colleagues. They're very solid residents. So I think it's a good idea to maybe look around the country and see where IMGs are applying and matching to, and looking into the.
Just to piggyback on that, some of these program directors of the psychiatry programs were IMGs or FMGs themselves, and sometimes they tend to see themselves in the applicants that apply to their program. So you might find one with that understands the journey that you're going through as well. I'm currently at Texas Tech University Health Sciences Center, and my program director was an IMG.
Oh, great. And then constantly you guys are in the position where you are serving others and listening to others' stories. How do you serve yourself? How do you then fill up your own cup so that you can be able to present your best self to your patients? What does that look like for you guys?
Yeah, I'll throw out physician, know thyself. And I'd say medical student, know thyself, resident, know thyself. So learn what your limits are. I didn't do a lot of therapy or self-reflection during medical school because I didn't know any better, honestly. And I was really blessed and lucky to go to the University of Kentucky, where they infused a lot of therapy in the psychiatry that we learned. There were just as many psychoanalysts on staff as there were psychopharmacologists. And so that helped. But then just going to therapy myself was incredibly beneficial, like going through the process, learning about myself. And so now I know to make space for myself and make time for myself. So I sing, I play tennis. I do my best to not work 40 hours a week, because when I do, that just makes me grumpy. I try to have space for other projects. So I was president of my neighborhood association. I would go and volunteer and do like career days, things that were traditionally not in the wheelhouse of a practicing doctor. And that's one of the beautiful parts about being a psychiatrist is you get to create your own adventure. And so those are a few of the ways that I keep my sanity amongst all of the anxiety and depression and COVID trauma.
Right.
I'll echo Dr. Dixon. It is really important that you take some time to figure out what it is that helps you feel better. So it can be anything. It can be very involved. It doesn't have to be, but you have to take that time because you're working so hard as a medical student trying to get into a residency. And as a resident, you'll be working even harder. And as an attending, you'll be working even harder. So learning those skills early is so important, and finding out whatever it is. So listening to music, I love to go for a jog, but I really love to teach. And so for me, it may be finding a place that allows me to carve some time away from the clinic to do some teaching. And that allows me to recharge and allows me to be a better physician for the patients that I see. But that's me. And so it took me a long time to find that balance. And so recognizing that it may take some time, but taking the time that you need to figure out what it is that helps you feel better and helps you kind of deal with all the different challenges that are going to come up.
Yeah, for me, I spent an hour in the barbershop yesterday, getting my haircut, swapping stories, and catching up on popular culture. So that's how my relaxation looks.
Oh, good.
I think for my relaxation, it's I still watch cartoons, not the anime or the other stuff, the really super old school, like, the Looney Tunes, Tom and Jerry, things that are going to make me laugh, because I think when you can laugh and enjoy just, humor, then it protects you from a lot of other things. Now, I work in academics, so things that drive me crazy is rarely patients, even patients who are upset at you because you didn't do something that they wanted you to, or hard cases. It's all the administrative stuff that is time consuming or energy sucking, as I like to say, for those. So, so it's, I love getting up and saying, I wonder what I'm going to hear today. Right. Not from the administrative part, but from the patient's perspective. Because they're all, I see kids, and kids, despite their adversity, are still kids. They still want to have fun. They still joke around. They still play. They do what any other kid without mental health issues do. And so seeing them progress, get better, helping parents get better and take care of their mental health needs, is very rewarding. I think for psychiatry, if you decide to go into psychiatry, I think we're more exhausted at the end of the day because of the mental journeys that we walk through. And, we have to hear what people are saying, but we also have to hear what people are not saying and make the time to connect those dots to be able to understand what we as the providers need to do. So, I think surgeons who are operating 12 hours a day, they are totally exhausted, but I don't think it beats the mental exhaustion. So you need something to really unwind. You hear a lot of stories you prefer not to hear of kids' journeys. And so you need to be able to leave that at the office, right? And then go home and unwind and relax and be in the moment with your families. So, but I think it's the most rewarding work that I can do. And so I love doing it. And, so just be prepared, don't give up all the things, you're going to give up enough just because you're in school or you're training. And residency is basically, an apprenticeship. It is on the job training, plus all the studying you have to do without all the time you think you need to study. So you got to be prepared. But once you're there, and you have your piece of paper, then you are the captain of your ship, right? You are in total control, and you can go anywhere you want to do of where you want to go, because no one can take that piece of paper away from you once you reach that long journey.
Great. Thank you so much for that. I think before we go to our one-liner word of wisdom, I think it'll be interesting, especially with this group, to talk about the difference between practicing psychiatry in an academic setting versus a private practice setting. I think that's something that we don't get that often. So would love to hear that difference, and also perhaps intertwine with that, the creativity that you guys were skirting around. So what does that look like in your field?
Yeah, I'll jump in from the private practice perspective. So I've worked, I did community mental health. I worked at a federally qualified health center, a multi-specialty group. So I kind of jumped around to try to figure out who I was. And as I mentioned earlier, I realized I need to work for myself. And so when I started my practice, I made a promise to myself to do the things that to do the things better that I thought did not go well in the other settings. And so, for example, I really like to teach. And I like to do lots of parent education and parent coaching. And so I made sure to just infuse that into my process. And so every person that comes into my clinic, they get a behavior plan that's put together by me personally. I get to print it out, and then I get to schedule people when I want to. I get to make my appointments as long as I want to. And those are those like little bitty creative pieces. Now, I always want to be clear. I always practice standard of care, right? I'm making sure that I'm really safe with medications. I'm using the best guidelines that I can think of. And if I ever use anything off label, then I make sure to do all of my informed consent. But yeah, you get a little bit more just flexibility. Like Dr. Bailey was saying, the administrative part of being in academia can be very constricting. I teach part-time over at the medical school, and when I at the TCU Medical School. And so when Dr. Bailey, Dr. Atkinson says hello. She says that you're awesome, and she says hello. And so just as an example, so I'm teaching in the medical school, and I have to not only have my curriculum done, I have to go to all these meetings, and then I have to map it, the different objectives to the goals, and then make sure that when I'm writing the exam, that I have test questions of a certain complexity, and it's just a lot. Whereas when I'm in my clinic, when the 5-year-old runs down the hallway, and I can be like, hey, Bobby, that ain't what we're doing here, right? And I can speak how I want to speak, and I can do what I want to do. That's the beauty. And so ideally, I teach a little bit. I do mainly private practice, and then I get to go do community development work. And so that's kind of how I juggle everything.
Yeah.
So I have kind of a slightly different perspective in that I'm in the emergency room, not as often as I would like to be, but also in a community-based clinic. And so get to see lots of different types of illnesses and varying severity of illnesses. And in the clinic, because of the nature of the clinic and who we serve, I do get to be creative in some of the interventions that we're looking at as far as, okay, what are the community resources that we can bring together? What is available? What are some things that I might not have thought of when I'm collaborating with social work about some issues that they have a mental health component, but if we can get this other thing under control, that there will be a significant benefit in treatment. And for me, I have always fallen to academics, partly because I'm just a big nerd who gets distracted very easily. And so I love academics because it lets me ask really interesting questions and kind of take some time to do that. And so I've also recognized that I'm very fortunate. During Hurricane Harvey, we kind of were in a setting where we were trying to help people. And I had a question of, well, kind of, would we see different suicide rates based on kind of what happened with flooding? And so academics allowed me to pull together a bunch of data and put that together and look at what were the responses to the police based on kind of where the flooding was, and just interesting questions that I consider interesting. And academics allows for a freedom of that is important, but it is exhausting with the administrative. And I do very kind of lightweight research. I don't have to deal with the NIH and all of the funding and all of those things. But that's my, I guess, very soft pitch for academics as another avenue.
Yeah, that's great. I think seeing that difference between the two and knowing that there's just so many other differences that we probably didn't even touch upon just makes us feel so much more exciting to be into. And then realizing that whichever direction you go in, there are going to be some unpleasant parts. And it's just a matter of like where your skill sets align with being able to overcome those unpleasant parts, right? If it aligns more with the private practice and go down that route, and if it aligns more with the academic and making sure you can deal with administration and go down that route. So great advice. And let's just close out with our one-line word of wisdom from all of you guys. What would you give to somebody wanting to come into your field and be where you are right now?
So I think for my one line would be to, whether you pick my field or some other field, is protect your dream. Do what you need to do to protect it.
Protect your dream. We've been dropping those lines all day, so that was a nice one.
Yeah, I was gonna say my one-liner for psychiatry, and I think everybody should go into psychiatry because it's awesome. It's the best field ever. I have the best job ever. I'm gonna say you can build what you want to help as many people as you can.
You can build what you want to help as many people as you can. That's powerful.
I'll just leave it at 2 words: remain hopeful. And that can be hope for the system. It can be hope for your patients. It can be hope for yourself. But remain hopeful, and that serves within psychiatry, I think, particularly, but in other fields as well.
Yes. So I'm first year medical student, and these things are still, this is good for me right now. So 4th day on in medical school. So this is good to hear.
I would say find something that you love to do, a field of medicine that you love. The days are going to be long. Patients are going to be challenging. There's going to be a lot of paperwork, but doing what you love, I think, makes all of that a little bit easier.
Yeah, definitely.
I think my take home message will be take care of yourself, love yourself so you can be there for your patients.
Could not have said it better myself. Thank you, thank you. Thank you so much. Thank you again to our amazing panelists. We appreciate your support of the SNMA and our membership. For those of you in the audience, please become an SNMA member and visit our snma.org and sign up to be connected. Thanks for tuning in, and we look forward to you to coming to our other Sowing Seeds every Wednesday. Today was an anomaly on Thursday, but we do have it on Wednesdays, 8 p.m. Eastern Standard Time, and we're going to be looking at so many other specialties. So stay tuned and be connected. Join the SNMA, and we'd love to see you back here. With that, we'd like to say thank you to our panelists one last time, and we hope to see you in our next Sowing Seeds. Thank you, thank you, thank you.